we remove or close veins as a means of getting rid of the varicose veins from the patient's legs. These veins are actually causing problems in that they are causing a lot of symptoms and potentially complications in patients who suffer from this condition. Varicose veins are caused when the valves in the veins, the one-way valves in the veins, fail. The blood is trying to return up to the heart, and frequently this is against gravity. And if these one-way valves fail, it allows for two-directional flow in the veins. And over time, this increased flow causes the veins to stretch and to distend, and the pressures in these veins and the blood pressure in these veins increases. The veins in the legs, and that can cause a low-grade inflammatory state. And when you have this inflammation going on in the legs and the stagnant blood, that's what causes all the symptoms that are related to varicose veins, which would include commonly pain or aching, cramping, throbbing, restlessness, swelling or heaviness in the legs, itching and burning. And over time, this long-standing hypertension can cause, venous hypertension can cause issues with progressive skin changes like darkening and hardening of the legs. And the hardening can get to the point where the skin actually breaks down and causes wounds on the legs called venous ulcers. These wounds can be very hard to heal. They can last for years sometimes. So the reason we remove or close off varicose veins is to keep this process from happening. When we close off the veins, the body views the veins as dead. And when the veins are viewed as dead, the body itself will slowly dissolve the veins, remove them from the system. This usually takes about 3 to 4 months after the veins are closed. Well, the good thing is the answer to that is that they're not. The good thing is that we were born with a great surplus of veins. We have literally miles of veins in the legs. So as compared to the arteries in the legs are important. Each one has an important job. It brings blood to specific muscles or organs. But the veins, there's a huge parallel network of channels of veins in your body, including your legs. So the good news is your body can do without them. If we actually remove the veins, not only can do without these veins, it actually improves the circulation because now the blood can only flow through veins that have healthy valves and healthy veins, and the blood is more likely to pass freely up to the heart. And then the other consideration about these veins is that the veins that we work on are called superficial veins. And by superficial, that means that the veins are outside the muscle. And most of the blood that returns to the heart, which is the role of the veins in the legs, most of the blood that returns to the heart returns through the deeper veins that are in the muscles. And those veins we never touch or disturb. And it's estimated that 90% of the blood returned to the heart goes through these deeper veins. Yes. So obviously, if the vein is closed off or removed and blood can no longer go there, it's just going to go the path of least resistance. And luckily, the veins left behind that are left to recruit the movement of this blood, they all have healthy veins. So now the blood will move actually more efficiently up to the heart. Most people, the most common concern I get from patients is, aren't these veins important? One of the veins we commonly treat is called the great saphenous vein. It runs the whole length of the leg. It's the longest named vein in your body. But it's a misnomer. It's not great. It's not important. If the vein is diseased, it's actually harmful to your body and best to get rid of. Well, unfortunately, the truth is that if you have these the tendency to form these veins, then yes, likely you will get new varicose veins over time. These veins, people that develop varicose veins usually have a predisposition to forming these, and so they will. We can only remove the veins that are existing presently. We can't take away your tendency to form these new diseased veins. That being said, most patients who come to see me for treatment have developed these veins over a period of many years. And when they do tend to come back, they come back slowly. And we do check people for this reason once a year after we're finished their treatment. We don't treat every single little varicose vein that comes back because there's no need to treat a varicose vein if it's not bothersome, causing symptoms or complications. But when and if it gets to the point where the veins are getting bad enough that they're causing issues, then we will retreat the patient. And typically they require a lot less treatment after their initial treatment plan. Well, we talked about the fact that veins, you tend to get these back, the veins that slowly over time because you have a predisposition. And by the way, when I discussed that, I left out the fact that the veins that we treat do rarely come back. The majority of the veins we treat are permanently gone. The problem is the formation of new veins. But getting back to what you're saying, as far as the factors that cause this, the biggest factors are beyond our control. The main factor that causes this is hereditary, and obviously we can't change our genes. And the next major factor that causes this is aging. And so obviously as we get older, just like a car ages and parts break down, the valves in our veins can break down and they could fail. So aging is a major factor. And the third major factor that causes varicose veins is females. Females are predisposed for two reasons. One is because of it's felt that the female hormones predispose them to developing varicose veins. And also women who have had children in the past. So pregnancy puts a strain on the veins in the legs and can predispose you to varicose veins. So it's for this reason that varicose veins are about twice as common in women as they are in men. So the main factors that cause varicose veins can't be controlled. But there are factors that can be controlled. People who have jobs where they stand or sit extensively, they are more predisposed to developing varicose veins. That being said, most people don't pick their jobs or their career or their hobbies based on varicose veins, since it's so easy to treat these. And obesity may play a role as well, because if you have a lot of extra central body fat, that may help provide some obstruction to the veins, going up to the heart. It'll put some back pressure on the veins and cause you to maybe form worse varicose veins than otherwise you would have. Compression stockings is controversial because it's never been proven through definitive studies that wearing them will reduce the amount of varicose veins you have or keep the varicose veins you have from getting worse. But theoretically, compression stockings can be helpful because they do help the pressure gradient and help the blood return from your legs, and may make it less stressful on the veins that are predisposed to developing the varicose veins, and therefore maybe they won't form varicose veins as quickly. But it's not been scientifically proven. Well, I would tell people, first of all, you may have heard some horror stories of other people who have been treated in the past. And in the past, the treatment of varicose veins was predominantly surgical. There was a lot more pain and suffering involved with this, high risk of complications, missed time from work. And nowadays, our treatments are really minimally painful. Most patients feel nothing more than simple little needle pokes in the office during their procedures. The appointments are no more than an hour. The procedures are shorter than that. And people can return to normal activities almost immediately. They can go back to work the same day or back to their daily activities the same day if they choose, with very little restriction. Most patients afterwards have very little pain from the treatments if they take anything that's Tylenol or Advil. It's extremely rare that I have to prescribe anything stronger than that. And the risk of any kind of complication from varicose vein treatment is very, very low. And we do monitor the patients. We always check them within a week of a procedure to make sure that the treatment went well and there are no complications. Because if there was a complication, it could be often addressed so that things will not get worse. So I would say that at least get educated on what the options are for varicose veins so that you don't make your decision without the facts. The fact is you can be treated with very little pain, with very little interruption in your life, and then there is a lot of long-term disability associated with varicose veins, because once you get to these changes we talked before about the skin changes, the pigment changes, the swelling, the hardening, and the ulcers, many of those skin changes are irreversible if you let your veins go untreated over the years. It's best to treat it early rather than late.